Thank you, Mr. President. The White House Coronavirus Task Force met today, but we also convened, at the President's direction, a conference call with the nation's governors. We focused on efforts at mitigation, at testing, and supplies. We discussed the President's recent approval of disaster declarations for Washington and California and New York. But we also assured governors who've submitted major disaster declarations that we will be reviewing them in an expeditious manner to ensure the full resources the federal government are brought to bear. The President wanted us to make it clear that the federal government will do whatever it takes to support an effort that is locally executed, state managed, and federally supported. We reiterated that to our governors today, listened to them about their specific needs, and frankly, made it clear to them that while the President has published at coronavirus.gov the 15 days to slow the spread for every American, and millions of Americans are addressing these common sense guidelines to prevent the spread of the coronavirus in the days ahead, we made it clear to the governors that this President and this administration fully supports decisions that governors are making in communities and states that are particularly impacted by the spread of the coronavirus, and we are grateful for their efforts. We also spoke to the governors about the importance of the legislation that is currently being negotiated on Capitol Hill and asked them to encourage members of the House and the Senate to move very quickly. The bill that is currently being negotiated, the President said that he believes will be resolved soon, and we're encouraged by it. We'll speed direct payments to families. The average family of 4 will receive $3,000 directly. There'll be payroll subsidies for small businesses around America to keep people on the payroll while they might be required to stay home, unemployment insurance benefits, assistance to hospitals and major industries, and we continue to urge the Congress to act and ask the governors to engage their delegations. On the subject of testing, we reiterated our thanks to states across the country that are rapidly expanding testing at drive-through sites and at community sites. As Dr. Birx just reflected, because of the unprecedented public and private partnership that the President initiated with our commercial labs, we stand here today with 313,000 tests having been completed, with the test results delivered to Americans, and still somewhat more than 41,000 have contracted coronavirus. But this state-run effort is continuing to receive the full support of our team at FEMA and at the U.S. Public Health Service. We're deploying personnel, we're deploying resources, and testing is literally expanding around the country by the hour. As Dr. Birx also mentioned, the FDA has been in the process of reviewing less invasive methods of testing. The President and I both reflected on the fact that we have been tested, and we've been working with the FDA to make it possible for self-collected nasal swabs, where individuals could, at the end of their nasal passage, collect a sample, and I'm pleased to report that self-collected swabs can now be collected in clinics and at drive-through testing sites. This will expedite the testing process, of course, but it will also reduce the risk to healthcare providers for exposure to the coronavirus, and it will minimize the drain on personal protective equipment. With the current test that goes pretty significantly up the nasal passage, people have to wear gear and then change out the gear. And this new self-administered test will actually not require the drain on personal protective equipment, and it's all a part of our effort, as Admiral Polovchek will discuss in just a few moments, to meet the supply needs that we have across the country, but to meet them with efforts at conservation as well. On the subject of testing, it's important to remember, as the old book said, it is not the healthy who need a doctor, but the sick. And so if you don't have symptoms, you don't need to get a coronavirus test. We encourage every American to adhere to that so that the testing resources are available for people that are symptomatics. We also will be issuing today from Health and Human Services new guidance to direct all commercial labs to prioritize testing for hospitalized patients, and that guidance is going out tonight. We also reminded the governors today that all state laboratories, all hospital laboratories are now required by law to report the results of coronavirus tests to the CDC. On the subject of supplies, in our meeting today at FEMA, we received a report of the new Supply Chain Stabilization Task Force. Rear Admiral John Polovchek is leading that up at FEMA, and the task force is working to identify medical supplies that exist in the marketplace today, to evaluate the national stockpile, and also working with industries around the country to produce even more of the critical medical supplies. And as the President said, businesses across America are stepping up, and maybe as never before in our history. 3M, in fact, has diverted 500,000 N95 masks from commercial customers, and they're being delivered today to New York and Seattle. Facebook, we would acknowledge, has donated their emergency reserve of over 700,000 N95 masks to healthcare workers, and these are just a few examples of the generosity of businesses. We're also seeing companies step forward to repurpose their manufacturing facilities to create ventilators, to create equipment, and I know I speak for the President when I say how grateful and proud we are for that. We also discussed with the governors a real breakthrough on the availability of ventilators. We called on the governors to survey all outpatient surgical centers and hospital operating rooms, because surgical ventilators that anesthesiologists use, because of an FDA decision rendered this last weekend, those can be easily converted now to ventilators that can be used for people struggling with severe illness from the coronavirus. And so we called on our governors in conversations with state leaders to survey all of their surgical centers and hospital operating rooms to identify that equipment, and with the new FDA guidelines, they'll be able to convert those to help meet the needs of ventilators across the country. We are now 8 days into the President's 15 days to slow the spread. And the American people are rising to the challenge. We're doing this. But in the days that remain between now and the end of the 15 days, we're going to need every American to take this seriously. Listen to your state and local health authorities, where there may be additional and stronger guidance in areas where the coronavirus spread has been more severe. But for every American, know that the part that you do, that your family does, that you do in your community to put into practice these principles of social distancing, using a drive-through at the local restaurant, will make an enormous difference in lowering the trajectory of the coronavirus spreading across our country. It's going to take all of us, but with the ongoing cooperation of the American people, with compassion, with the ingenuity of American industry, with dedicated leadership at the state and federal level, I know that we can slow the spread, we can protect our most vulnerable, and we will heal our land.